It's described as a state investment in local public health and an initiative that will transform public health in Indiana. It's the outcome of legislation in 2023 with funds intended to go to county health departments to improve resources and address critical needs in partnership with elected officials, hospitals, clinics, and schools. And we'll learn more about the impact of this initiative known as Health First Indiana on this week's Primetime. And good evening, I'm Bruce Haines. Our guests today are Mindy Waldron, Administrator and Deputy Health Commissioner of the Allen County Health Department. And with Mindy is Marilyn Hissong, East Allen County Schools Superintendent, and 80th District Democratic State Representative Phil GiaQuinta. And we're glad you're here as well. If you have a question or a comment you'd like to share during the conversation, please feel free to dial it in with the numbers you see there on the screen. As we say hello to Mindy, Phil, and Marilyn. Happy New Year.
Same to you.
Happy New Year.
Same to you.
That greeting goes on for a little while, I think, which is a good thing. And what a good new year for those involved in all of Indiana's counties in concert with their local communities as there is a proactive initiative, indeed, unfolding. For a lot of folks, perhaps they're really wanting to go back to this future and wonder when Health First Indiana came to be. What's the backstory on what we're talking about tonight?
Sure. So it started through the Governor's Health Commission. Governor Holcomb put together a commission made up of some of the physicians, other healthcare organizations, local health departments, to discuss the public health infrastructure. And it was a year-long type of group that met, talking about the issues, the needs, changes that might make us better, more proactive in Indiana, especially on the heels of COVID. Mm-hmm. The outcomes of that were a very large report that talked about the ways to better public health in Indiana, and specifically through county health departments and other organizations. And that resulted in historic legislation, thanks to all of our legislators in 2023, as you referenced, the funding, unprecedented funding to local health departments in Indiana. We've been at the 48th or so mark in the United States for the states for public health and preventive medicine. And we're going to take a huge leap with this. So that was in 2023, the funding came in 2024, and now we're starting some of these important initiatives.
Wow. And in 2025, it all rolls out across all counties, as I understand it. Phil, getting something like this funded is something certainly, too, in its inaugural term or tour of duty is quite an accomplishment legislatively.
Yeah, it really is. It's something that a lot of legislators, including myself, we've been asking for this funding for a long time, recognizing where Indiana ranks with regard to the healthcare measurements compared to other states across the country, and we haven't been very good, quite honestly. So this is I'm very happy to support the legislation. Very pleased that Governor Holcomb decided to push for this. I've said this a couple times. One of the things, I think, of many things, besides learning how to get on Zoom, but because of COVID, was that really. When you looked around the state and some of our counties, not so much Allen, not so much the larger counties, but the smaller counties, really had a hard time, I believe, with their health department administering things, and I think COVID really sort of highlighted that. If we didn't really already know where we were and where we were ranked on some of those measurements, as I mentioned earlier, certainly COVID exposed them a lot more. And it was sort of the impetus, I think, to get folks moving and drive that number. And that was, while it wasn't quite what we asked for, but you can't always get everything that you want, it was very close to the amount. So we're happy with the amount of dollars.
What is it about this initiative that is transformative, that it sort of says we're going to take a road less traveled or maybe not traveled much at all? With funding, it goes to counties. Some might see, well, now our work is done. Mm-hmm. But what is it that takes it to a next level?
Well, to put a few things in perspective, we, as local health departments in Indiana, most of our money is either from tax money, so property taxes, and that varies in the county, so you have different levels of services provided or able to be provided in areas based on property tax monies. A lot of people used to seek grants for local health, and that was for your health care. We would seek grants to provide preventive services, and then we got a very small amount of state funding. So to give you an idea, in Allen County, we received enough that would cover 52 cents per capita in Allen County until, it was probably 30 or 40 years. Until last year, we took a jump until the $12 range, and now we will double that this coming year. So, you know, a couple pieces of candy amount is what we put into public health before for prevention. Health departments until then were simply doing the statutory duties of a lot of inspectional duties and some of the enforcement duties, and they're very important environmental duties. However, we weren't able to involve ourselves in the preventive services through healthcare. So the things that prevent you from having chronic disease such as obesity or diabetes, and some of our fatality review data, it all comes from the things that we're not doing well. And we have rank low for a number of years. So a lot of these services and the things that come with the money are requirements of things that we need to do. And it's aimed at getting into the areas about maternal child health, the things where we're low in a lot of our outcomes. We can now put and funnel money into organizations that are working in these areas, or ourselves deploy services. It's first of its time in Indiana to be able to do those things.
And in a review of those, it seemed that in that core, at least one, as you say, box needed to be checked: maternal and child health, chronic disease prevention, mainly obesity, and smoking and vaping prevention and cessation. So how were the funds in Allen County allocated?
Well, the money itself was allocated per population in your county. So Allen County, being third largest of the counties, did get a large amount. So we started out with about 4.6 million. That's very large for us. And so what came, as I said, there were core public health duty areas or core health areas that we have to provide services in, or ensure that they're provided in your area. So we did deploy services in all those areas you mentioned, in a number of them. There are 22 areas. We decided, though, to develop a grant program so that we could come alongside some of the organizations who have taken on these duties for years and are already doing maternal child health, prenatal care, chronic health issues. Came alongside them, funded them up a little bit, and augmented some of their services. And so we were able to choose. It's the way it was designed was, as long as those services are provided in your community, however that community and your elected officials see fit, it can be done. So we decided to do ours through a bit of a hybrid plan of us deploying services, working alongside organizations through grant programs, and then, as we're sort of here to talk about today a little bit, some of these outside of the box larger projects is where we funneled some of our money as well.
Yeah, and I wondered, did the light bulb then, Marilyn, come over the top of your head as well as Mindy simultaneously? Or when you're hearing this news of this initiative rolling out, easy, challenging to think, how can education find a place at the table with this activity?
Well, Mindy and her team do a great job of pulling us together, and when they do it, they get usually a lot of the Allen County superintendents together, as well as some other people from around the county, and we usually brainstorm, and I think that is the power of that group. We all have similar needs. We see similar things happening within our schools, and so it's probably that brainstorming that kind of created the whole vaping program that we have in front of us right now that we're using. I'm really excited about the initial results that we're seeing in our district. Right now, just first semester of this school year, we're already down 30 students who have not been reported vaping compared to last year. So I think we were about 143, and we're almost like at 110 right now. So it's a lot fewer students, and we're excited about that, and we're hoping that the program continues to yield those results. But I would tell you that program comes from all of us collaborating together.
Yeah, this is across all school systems. Everyone is finding their challenge with this. In some of the images that you've shared for the program for this evening, McMillan Health has a role apparently in this regard.
Well, when we met with the superintendent and said, hey, what is your biggest issue? What are you currently experiencing and all having a similar pain with? And the number one for all of them was vaping and the issues surrounding it. What do you do for enforcement of that? What do you do with the confiscated materials? How do we prevent it and educate? And so we said, if we were to provide training for you or have it, what would you hope to have? And some of them wanted it in school. Some wanted the kids to go to a facility. And McMillan is a bit of a hidden gem here. And they do a lot of this training. It was already built, and we're helping them build or create another age of training for some of this. And they said, yes, they would partner with us and be able to provide it at will, wherever they wanted those things. So we said, let's set up a program. We named it. We created materials for it for each of the schools, deployed it, and I think we are at 6,500 folks kids have been trained in this last 6 months. Over 220 programs have been done, 150 more coming. So we're very excited about it because we did deploy it to all public schools.
And just to add to that a little bit, it is reaching right now currently our 5th grade students in all of our schools, our 6th grade students, and our 7th grade students. So we're trying to intervene at a much earlier age because we're seeing the highest level of use probably in our high schools, where the research says 1 in 10 high school students generally vape. Those numbers are pretty high. So we want to intervene early and often and try to make sure that we're creating an environment that students understand that this is not something that they should be doing.
Here are some images taken not long ago over at Leo, I believe.
Leo Elementary.
And what's the response from the students? Are they find themselves engaged in this? Because it's certainly been at the periphery if it hasn't been right in front of them.
Yes, I would tell you they're very engaged, and I love the way Macmillan presents things because they get the students up and they get them moving. They're asking them questions, but they're also giving the students an opportunity to talk about situations that they've been in. And I was in one of them, and a student mentioned how one of their friends does it, and they wanted to know how to avoid it. And just to come out and ask that question in that meeting was huge because they're looking for a peer. And how do I address a peer when a peer is trying to get me to do something I know I shouldn't do? So I love that Macmillan is intervening with them, and they're doing a great job. I mean, they really are, and the kids are very much engaged.
And when we are seeing these, there is also a screenshot of some of the curriculum involved that Macmillan provides. There we go. I love the title of being able to break free from the clouds.
Vape escape, right.
And Phil, as you're seeing these symbols of activity, these representations of activity along this line, what's your take or sense of it all right now? This is feeling like, ooh, just what we were hoping.
Exactly, because when the program, when we first talked about the legislation, the money, there were a lot of legislators that say, what is this? It's a lot of money. What's it going toward? Is it going to be spent wisely? We were hoping that all 92 counties would buy in rather quickly. Most did. There were about 5, maybe a half a dozen holdouts, but now they're on board. And I think the reason they were a little skeptical as well is because they didn't want the state to come in and tell them what to do, what programs to run. So when we hear about the collaboration between the health care department and the superintendents and the things that they're doing at Macmillan, which is a great program, you can see then it's really now up to the counties all across Indiana to be able to come together, do the things that they've done here in Allen County, and roll out successful programs, which is, I think, what we're seeing now.
And there are programs that also come with those KPIs, the performance indicators and the metrics and all that, because everyone wants to know, and it's all literally baked in when it gets out to the classrooms.
It is, and the way we ran our grant program, as well as any programs that we deploy funding to, whether it's to schools or healthcare entities or other organizations, is we have to check the box of some of those KPIs or those key performance indicators that the state is looking for collectively, because our hope is that we're all deploying very similar programming so that we're targeting the issues that we know that we have troubles with in Indiana. So we committed to ensuring the funding went to where it needed to go to the issues that we knew we were the lowest on, and developed programming with a lot of these organizations and said, which of these measurements do you think in your program you are doing, or what we could help augment could you meet? Same with the schools. Everybody submits data. We're tracking that. We have a lot of mechanisms for developing heat maps to show where we're showing services. And just anecdotally, I can tell you that the funds that we received just through the first, and through just the first 9 months of 2024, we had already served over 40,000 people sought or were given or found services through an organization or an entity that was being provided money through this grant funding. So we're seeing an impact, we're hearing a lot of feedback, and we granted 29 organizations a large amount of money to do a lot of things to better the health here in Allen County, and we're pretty proud of that, and the schools have really stepped up as well.
This could be a quilt, but it is something for which perhaps your TV at home is still not big enough to capture it all. Tell us what we're seeing here.
Those are the 29 agencies that asked to be granted to help us meet those key performance measures and indicators through our funding. And these are all engaged in a program or a project that is public health centric, that they are experts in, and that they wanted to expand but couldn't due to the lack of funding. So when we came in and said, here are the things that we're hoping to achieve with this funding, what are you doing? They were able to step up and say, oh, we have always wanted to do nutrition training in the school or at a facility, but we didn't have the staffing. Could you fund that? And so each of them are very different, but they all check those boxes of the things we're hoping to achieve collaboratively. We did site visits to each of the entities that we funded, and we learned so much about all the organizations here locally that were already engaged in this work that local health really should have been doing, and now we're partners in this goal.
And that really is a way of answering this question, but I wonder if there's any other information you would like to share in that going with nonprofits directly as opposed to providing services in-house. It seems that it has expedited the rollout of these programs.
You know, when you're a grantee yourself, and that's how you're funding public health in your community, and you're scraping together the dollars and the staff to do the things that you're required to do. When you are given funds to do all of these great and preventive things, it came so quickly. So we didn't have the infrastructure in place, we didn't have staffing to deploy it. And really, should it be things that we do? Maybe people trust some of the other organizations, or they feel more comfortable with their school folks. So we did feel like a hybrid approach was best for Allen County due to our size and those that are already engaged in those things. So it's going very well so far, and for 2025, we'll grant 48 programs. So we're nearly doubling. And we've granted out over $3 million this year. We'll grant out near that next year. And that's all to entities who are experts in these things and didn't need to build the knowledge, just needed to expand what they're doing.
Yeah. What's been the feedback from your colleagues at the other school systems within the county when this topic comes up?
I think, like I said, it's a topic that all of us are dealing with. I would tell you, I think all of us are starting to see some of it transpire at a younger age, which before it was predominantly more high school students. We're starting to see our junior high students and even a few elementary students involved. And I tell you, that gets a little scary. The biggest thing I want to say is we need parents. We need parents to help in this initiative. We're going to do our best at school to do what we can, and Macmillan Health obviously is partnering with us in this, but we also need our parents to help with our students to make sure that they understand the dangers of vaping. And again, I would tell you across the county, we all saw it as an issue. When we came together with Mindy, it was like that was the number one thing we were all talking about. So this is something that we feel very strongly about.
Yeah.
And I'll tell you, and Marilyn will probably chime in, we also felt, and we reached out to the schools and said, what else do you need? And the Stop the Bleed, CPR, all of those trainings that they have to pay for or have done at certain hours, we said, what if we trained ourselves up and offered it for free to all schools? And so that's not just the public schools, but all schools in Allen County have the opportunity. We hired and created a position just for school and student health, and that's all they're doing is helping the schools with whatever they need. We've provided AEDs, we've provided a number of pieces of equipment to schools. We've really tried to get ahead of a lot of this, get a jump start, and provide the education, especially on some of the bigger topics like the vaping and smoking issues.
And with that, I just want to say, one of the things that this new person did, she created a PSA and she asked them to do a video. And so high school students across all of our districts could submit a video. We had 2 submissions from East Allen, one at East Allen University and one at Woodland, that were both accepted. But the students, the high school students, were so involved and they were so excited to do this PSA. And I think that's huge. The kids understand that they need to make a difference, and it starts with them. So that was very powerful. We brought the 2 students into our board meeting and they displayed it. They shared their video and they talked about how they created it. there are so many skills that they were using during that time, but also you could tell they were wrapped around a cause. They understood that this was something we needed to do.
Phil, stories at the State House from your colleagues on whether, again, this is not just an Allen County moment, it's something bigger.
Yeah, I mean, look, I'll tell you that I mentioned before about making sure that money is spent wisely. I mean, that's just not us, but that's what our constituents want us to do. The second thing that they want you to do is try and lower costs all across wherever we can. And if we can get folks healthier and do these things that are proactive, what better way than to save on healthcare costs if we have a healthier society? What better way to make sure kids are going to school and going to class if they're healthier? And you know, you talk about vaping, and I don't know how long it's been around, but it wasn't around when I was in high school. I know that. And so it's one of those things that's new, fairly new, and we have to keep up on. So I'm sure we probably want reports and things like that, how the money has been spent, how the programs are going, but all indicators look like we're in the right direction, and it's very good. And that'll help with the next go round of funding too, so that's good.
Well, and let's go there briefly, just to find out what you feel the prospects for Health First Indiana funding in the budget session this year might be.
Well, we know, look, we're not going to have the federal dollars that we've had in the budgets the last two, in 21 and 23, so it's going to be a little bit tighter, but again, I think these things are showing that investment does work, and that we're going to save money in the long run. Maybe some upfront costs, and that's what we've seen so far, but I do believe that it's going to show that it's better to invest in folks' health via education, everything that you've heard here today. And I do think that's going to help us in our arguments to put as much money in the budget for health care, and these type of causes that we can. So it's a good start. It's a good story to have, and I think it's going to be very helpful.
There are other facets of the story as well, as the vaping cessation activities continue and the focus on obesity, but there have also been supports for other areas, GC's Playhouse, among others. Talk about that.
Yes, one of the other major areas of focus was the prevention of chronic disease, specifically diabetes, heart disease. It's the #1 cause of death. So we worked with several entities who submitted applications to work with special populations or areas of our city that maybe didn't have those services in place. And GG's Playhouse, for example, was one who stepped up and said, hey, we'd like to deploy our nutrition and our chronic disease prevention programming to those folks with Down syndrome. And so their program is very inspirational to see, as well as Children's Autism Center. We have Fort Wayne Community Schools who implemented nutrition cooking in their 7th grade classes, enormously impactful. So we have a variety of things happen over the major 8 areas that we funded.
And also, we should share blessings in a backpack. In fact, if each of the organizations that were featured in the earlier graphic had sent one a supporting photo, we'd have to make this an hour-long show, I think.
And they did send them. I only sent you a few. But to dial in what Phil said, that return on investment, it's estimated to be somewhere around $14 a return for every dollar you invest in preventive health care. And so if we extrapolate that out across the state and all the work the health departments and the State Department of Health and all of the medical organizations are doing in the schools, if we can add that all up, we know we are making an impact, and that lessening of healthcare costs, lessening of insurance costs, and lessening of productivity losses is going to show over those next 10 years. So we need to invest in that money. So we appreciate it.
You know, what we're hearing too is there are some returns you can see now, but there have also been those other returns which in the health field it can take years to see. Speak to that as.
It's such a good point, because we're often asked, what are the outcomes after that first year, Mindy? Well, that's probably going to be 5 to 10 years before we'll actually see some of those unfortunate numbers rise or lower, whichever they are. So we know we have some time where we've got to hunker down, do the work, and hope that those numbers get better for us. Some of the things that we are seeing, because we have required most of our entities to do pre and post tests, kind of see if the education has stuck, and we're starting to see really good results from some of that. We're also seeing that we're impacting a lot of zip codes that didn't have certain services in them. Those are the tangible things we can see now, but I suspect over the next, or we hope over the next 5 to 10 years, we'll see some of our outcomes be better when we're published at being so low for being overweight or smoking costs. We hope those are bettered by some of this education.
We should share too, as we conclude our time today, that Health First Indiana has a website wherein if you are watching us from Noble County or Wabash County or Kosciuszko County, you can go right to the top of the website and click on that and get your own county's activities, so everyone's in.
Yes.
Everyone can play. And if you would like to find more information about what I believe is called Health First Allen County, you can find that information also online by heading over to the Allen County Health Department's website, and we have a graphic for that, as we want to again thank our guest this evening, Mindy Waldron, Administrator and Deputy Health Commissioner of the Allen County Health Department, Marilyn Hissong, East Allen County School Superintendent, and 80th District Democratic State Representative and House Minority Leader Phil GiaQuinta. Thank you, sir. Thank you, ladies, very much.
Thank you.
And thank you for joining us as well. For everyone with Primetime, I'm Bruce Haines. Take care, and we'll see you next week. Good night. The preceding program on PBS Fort Wayne was made possible in part by
the Kendallville Area Chamber of Commerce, in partnership with the U.S. Chamber of Commerce Foundation, presents the National Civics Bee local competition. Essays are due February 4th, and the top 20 competition is March 13th. Details at kendallvillechamber.com. The Rogers Company has been conducting business in Northeast Indiana since 1944 as Rogers Markets, and now as the Rogers Company, with commercial property and real estate development. Pleased to support local not-for-profits and PBS Fort Wayne. The Regional Chamber of Northeast Indiana advocates for world-class infrastructure, a competitive business climate, 21st century talent, and rural investment. One region, one voice. NEINadvocates.com.